Hi everyone, myself Dr. Sumalatha, working as reader in the Department of Oral Medicine and Radiology, Babu Banarasi College of Dental Sciences, Lucknow. Today we are going to discuss on X-ray films and accessories. To introduce the topic, the X-ray film is the image receptor used in dental radiology. X-ray films helps us to record the information regarding the object through which the X-rays pass, and hence they greatly help in diagnosis and treatment of patient problem. Coming to the classification of the X-ray film, based on their use, they are classified into intraoral films and extraoral films. Intraoral films are those films that are used inside the oral cavity. They are again classified into periapical films, occlusal films and bite-wing films. As the name suggests, extraoral films means the films are placed outside the oral cavity. The second classification is based on the coating of emulsion. They are classified into single coated and double coated. Single coated are those films in which the emulsion is coated on only one side of the base. So these produces better and sharper images but requires less exposure, and they are used only in industrial radiography. The double coated films are those films in which the emulsion is coated on both the sides of the base. These allows for lesser exposure to the patient. The third classification is based on the speed of the film. They are classified into mainly three categories: slow films, fast films, hyperspeed G. Slow films. These have very small grain of silver bromide emulsion on one side only. Example for slow speed films are A, B and C speed films. The fast films. These are larger grain size and emulsion on both the sides. Their speeds are D speed, that is ultra speed, E, that is extra speed, and F, that is ultra high speed. The third category is hyperspeed G. This is a 800 speed film that can off the patient exposure without blurring image quality. Based on the packaging, they are classified into single film packet and double film packet. The single film packet, it contains only one film, and the double film packet, it contains two films that are placed close to each other. When they radiographed, the second film will act as a duplicate. Based on the presence or absence of the screens, they are classified into screen films and non-screen films. Screen films are two types: the film which is sensitive to blue light, example calcium tungstate screens, and the film which is sensitive to green light, example rare earth screen. So this completes the classification. Coming to the composition of the X-ray film. The X-ray film consists of two principal components, emulsion and the base. The emulsion is sensitive to X-rays and visible light. This records the radiographic image. The base is a plastic supporting material onto which the emulsion is coated. Base is a transparent supporting material upon which the emulsion is coated. Dental film base is composed of polyester polyethylene terephthalate, which is about 0.18 mm thick. Coming to the requirements of the base. The base should be flexible For ease of handling, it should be translucent, casting no pattern on the resultant radiograph. It should have a bluish tint for optimal view of diagnostic film. It should be able to withstand exposure to processing solution without distorting heat, moisture and chemical fogging. The second layer in the film is subcoating. It is a thin adhesive material on both the sides of the base which ensures good adhesion between sensitive emulsion and film base. Third component is emulsion. It is coated on either side of the base, mainly contain silver bromide crystal suspended in the gelatin matrix. This is photosensitive to X-rays and visible light. The films intended to be exposed to X-rays are called direct exposure film. So all intraoral films are direct exposure films. Next is in detail we'll discuss about the emulsion layer. The emulsion, as I already told, mainly consists of silver alloyed crystals, which consists of 80 to 99% of silver bromide and to a lesser extent silver iodide crystals. So this is a diagram depicting the composition of the X-ray film. In the center there is a base, on either side it is coated with emulsion. The emulsion is supported by an overcoat. The silver alloyed crystals, which contain silver bromide and less quantities of silver iodide crystal. Along with that, some sulfur compounds are added to the emulsion to increase the photosensitivity of the film, thereby reducing the radiation dose required to produce the image of adequate diagnostic quality. The silver alloyed crystals absorb radiation during X-ray exposure and store energy from the radiation. Gelatin matrix. It supports the silver alloyed crystals and it is made up of cattle bone, which helps to keep the silver alloyed crystals evenly dispersed. So during processing of the X-ray film, the gelatin absorbs the processing solution and allows the chemicals to reach and react with the silver alloyed grains. The super coat is a protective, transparent, non-abrasive layer over the emulsion. So this additional layer will serve as a protective barrier and protect the film from damage by mechanical handling such as scratching, contamination, or pressure from rollers whenever automatic processor is used. So before going the other things, we will discuss little bit about the film speed. Speed refers to the amount of radiation required to produce a radiograph of standard density. The speed of the film is determined by the size of the silver alloyed crystals, thickness of the emulsion, and the presence of special radiosensitive dyes. So as I already told, the intraoral films classified again into periapical films, bite-wing films and occlusal films. The periapical films, they are mainly used to record the crown, root and periapical area related to the tooth. They are of three sizes. Number 0 used for children, which is 22 into 35 millimeter. Number 1 is used for anterior adult projection, which is 24 into 40 millimeter. And number 2 is used for adult posterior tooth, which is 31 into 41 millimeter in thickness. The occlusal films, they are used to cover the larger areas of maxilla and mandible, which is approximately 57 into 76 millimeter in thickness. The bite-wing films record the crowns of maxillary and mandibular teeth in one film. This helps in detection of interproximal caries, visualize the alveolar crust and assessment of the periodontal diseases. So this is a diagram showing the different sizes and types of intraoral film. So coming to the components present inside the film packet, there are mainly 4 components present inside the film packet. The first is the outer plastic covering, which is made up of white paper or soft vinyl, which is hermetically sealed, semi-stiff, light-proof and clearly indicates which side of the film should be directed towards the X-ray tube. So this outer layer consists of 2 sides, one is tube side and the other is label side. The tube side is completely solid white and it has got embossed raised dot which should always place towards the X-ray tube. And the edge carrying the dot should always place towards the occlusal surfaces of the teeth. The second component is a lead foil, which is placed inside the plastic wrapper on the side of the film which is away from the tooth under consideration and X-ray tube. So the functions of this foil is it will absorb most of the X-rays which pass through the film and prevent reaching the tongue and other tissues. The other functions of lead foil is it also absorbs backscatter radiation and prevent the fogging of the film, and it gives sufficient rigidity to the film packet. In case if you place the film reverse in the mouth, the lead foil pattern will appear on the resultant image. The third component is black paper that wraps the film to protect it from any light leak. The X-ray film which has rounded corners and an embossed dot for orientation. The films inside the oral cavity will stabilized by various means, either by using finger holding method or by using film holders. What are film holders? The film holders are those equipment used to stabilize the film inside the oral cavity. There are various types of film holder. The first one is blade type of holders. Example for this throat stick, acrylic blade with slot and snap array film holder. The second film holder is bite block. It can be styrofoam block, snap array and artery forceps with bite block. The third is position indicating device. It's also known as RIN XCP. XCP stands for extension cone paralleling with normal or rectangular collimator. Next is the precision X-ray film holder. So this is a diagram showing the different types of film holders. The first one is disposable throat stick with film attached by cellophane tape. Second is acrylic blade with the film inserted in a slat. Third is plastic snap array film holder which is used in bisecting angle technique. Snap array film holder. This is a simple plastic film holder used for both anterior and posterior regions of the mouth. It does not have a film backing with it, so thus the film may bend and cause image distortion. This film holder is particularly used in mandibular premolars and molars projection and also in maxillary and mandibular third molar projection. This snap array film can also be used in patients with hypersensitivity gag reflexes. Fitzgerald hemostat, which is designed by Dr. Jordan Fitzgerald of University of California. It is used in patients with limited mouth opening. So this is a diagram showing the hemostat and a rubber bite block. These are the disposable stable bite blocks which were used earlier. The RIN XCP, it has got 2 instruments. One is for anterior and the other is for posterior, and it was designed by Dr. William J. Each instrument contains 3 parts: anterior and posterior bite blocks. Second is indicator rod and the third is locator ring. This RIN XCP instrument has been modified to include rectangular shaped locator ring that can be rotated on its own axis. This modification helps to reduce the exposure to the patient and simplifies the cone and film.